Hi, it's Dr. Scott with Revitalize. I've got my pink on today in support of breast cancer awareness. So October is Breast Cancer Awareness Month, and I know there's a lot of things going on like races and pink ribbons and pink shirts and pink outs at Ohio State and things like that. So I thought I should probably make a video on breast cancer, and I also really want to make a few that I'm going to do on a series on cancer. I do have a very close cousin of mine who was diagnosed with breast cancer. She's more like a sister to me. So this is definitely an interest of mine. And as a matter of fact, in integrative medicine, I'm happy to say that I'm partnering and looking at doing some research, especially on premenopausal breast cancer, because I feel very strongly that there's more integrative therapy both in diagnosis and treatment that we can do. So I'm hoping that's around the corner. But I just wanted to give you some statistics. Actually, breast cancer is the most common cancer in females. Over 30% of female cancers are breast cancer. Your lifetime risk is 1 in 8. Or 12%. Any woman, whether they're high risk or not, 1 in 8 is your lifetime risk of breast cancer. And so their survival has really increased since 1975. Now the 5-year survival is thought to be over 90%. And I think that's in part due to earlier detection and also to more prevention. So I would say that definitely we want to support earlier detection, but I also think, why don't we take one step back and think about more cancer prevention therapy? So that's what I'll be talking about in this series. The risk factor for breast cancer, I have to keep looking at my notes, but the risk factors are, number one, if you started your periods early, you're thought to be at risks of breast cancer. If you had a late menopause, you're thought to be at risk. Average age is 52, so late after that, increased risk of breast cancer. If you were late to have children after age 30, or if you didn't have any children, or if you didn't breastfeed your children, those all put you at increased risk for breast cancer. If you have an increased body mass index, so if you're obese or overweight, you're at increased risk for breast cancer. If you have more than 7 drinks a week, I think I talked about before, you're at increased risk for breast cancer, and smoking puts you at an increased risk for breast cancer. The last couple, if you have had childhood cancer and you had radiation of your chest, that could put you at increased risk, or radiation for any other therapy, a thyroid or something like that, that puts you at risk. And also dense breasts. So this is something that just recently is required to be reported on your mammogram report. And I know patients are asking me about it. What does that mean that I have dense breasts? Well, to me, dense breasts is a sign that you have a hormone imbalance, that you have more estrogen than progesterone. So those are the risk factors for breast cancer. And really get out there and just make sure that you're getting your screening done, because over half of the cancers are actually detected by patients. And recently, the American College of OBGYN put out a recommendation saying that clinical breast exams were not needed only every 3 years for younger patients, and also they discouraged patients from doing their own exams. So I don't know that I agree with this. I think that, they were citing that there was a high incidence of overdiagnosis and that patients had anxiety about additional procedures. But I encourage everyone to be aware of your hormone status, be aware if you have a risk status and that you need more testing. And I also think you should be doing your self-breast exams.